Built in the 1940s, Siloam is one of only 6 hospitals in the Vhembe district. The Provincial Department of Health handed over a fleet of 10 new ambulances to the hospital over 2 months ago. The handing over of the ambulances were greeted with much jubilation and optimism from communities who had endured years of poor emergency services. But more than 2 months later, residents say nothing has changed. This man has detailed a heart-wrenching account of how he had to transport a woman needing an urgent medical attention to hospital on the back of his bakkie.
I received a call from a lady who works at Matha Clinic. She called me and told me that there is a woman who is in labor and has to rush to hospital. She indicated that there was no ambulance available. I went to Biaba Clinic transporting her with a bakkie. They advised me to take her to Siloam Hospital because they also said that there was no ambulance available.
We are
not happy as residents who receive medical service from Siloam Hospital because of ambulances that are forever not available. The hospital received ambulances, but there are only 4 ambulance drivers. Only 2 ambulances are working. We hire private cars to take patients to hospital.
Community leaders say only 2 ambulances are working per shift.
We have engaged with the management for the hospital to say we have a problem with the issue whereby they deliver 10 ambulances at the Siloam Hospital, but only to find out it's only 2 per shift that is working. When we try to find out, we find that it's only 4 people who are working per shift. It means that if another ambulance is following or is going to fetch the patient in other area and the other one is fetching other patient in the area, so when you're calling it for emergency, it's not going to be available.
The Limpopo Department of Health responded by explaining how emergency services operate.
It's not true that we've got only 2 ambulances working at Siloam EMS station. We've got up to 10 ambulances currently that are there. We've just donated 10 ambulances to that station. So what people need to understand is that EMS workers work according to shifts. So currently at the station, we've got up to 12 crews. A crew is made out of 2 EMS employees who man 1 ambulance. So the 12 crews would work, let's say you would have 3 crews, which would mean you would have 3 ambulances during the day for 12 hours, and then you would have got another 2 for the 12 hours at night.
The department is continuing with unveiling of ambulances across the province. Rutendo Bobori, SABC News in Siloam.